Dr. Sajid again. I'm going to be talking about the baby's first month of life. One of the most important things, of course, is to feed the baby. For many reasons, breastfeeding is the best. The two most important advantages are, number one, that it provides immunity to the baby, especially regarding respiratory conditions, coughs, colds, flu, etc. And the second is that there is a lot of bonding. It also protects against intestinal infections, and so best is to breastfeed. This is done on demand, but on an average between 2 to 3 hours apart. And so if you can't breastfeed and are giving formula milk, you should also feed on demand, but keep some sort of a schedule. You continue to avoid infection, and so the mother and the baby should be kept separate, and there should be no visitors. And in these days of mosquitoes, one should have like a net on the baby or mosquito repellents generally in the room before the baby gets in. The baby's temperature needs to be maintained. 25 to 26 degrees is good enough. You should not overcover the baby. Some mothers do that even during the summer months. But if you have air conditioning and you think it's going to get very cold at night, the head should be covered. Immunization is another aspect that needs to be taken care of, and that is the BCG injection that is given on the arm if it wasn't given at birth. Polio drops, again, if they were not given at birth. And hepatitis B vaccine, some physicians give it not at birth but within the first 15 days of life. The baby can complain and can cry, and this you will gradually need to decipher to be able to tell what this crying is from. Is it from the baby's diaper being wet? Is it crying for hunger? Is it crying of discomfort, etc.? The baby, of course, sleeps quite a bit and may sleep as many as 18 to 20 hours in a day, which is fine. There should be some weight loss initially, and by 10 days the baby should start gaining weight. And on an average, the baby gains about 30 grams in a day. And when you look at it month-wise, the baby will have gained about 1 kilogram by the time a baby is 1 month old. So from 3.3 kg, which is the average in our country, you are going to see a gain of 1 kilogram. And of course, depending on the birth weight, the baby may gain more. The baby should be fairly comfortable and should be active and should really not give you a hard time. But there are some conditions that occur during the first month that you should keep track of. One is, the most important one is jaundice, which is yellow discoloration of the eyes and of the skin. And this usually occurs around the 3rd or 4th day of life, occurs in most babies, but will disappear by 10 to 12 days. So any yellow discoloration of the skin or of the eyes within the first day of life or beyond the 15 days of life must be checked. This, of course, is not the jaundice of hepatitis, and we can talk about what causes it maybe later on. But you must bring this to the attention of the doctor if it is in the first day of life or beyond the 15 days of life. You should also worry about a baby who's sleepy or who's lethargic all the time, especially if the baby does not feed and keeps crying constantly. If the baby has a high temperature, or if the baby's temperature is below normal, or if the baby starts to breathe more rapidly or has difficulty breathing. Similarly, any unusual rashes which are persistent, and any increase in the number of stools that the baby passes, especially if they're very loose and very large, and especially if there is any tinge of blood. These are signs that you should not ignore, and you should bring this to the attention of the doctor. So the first month is very important. You keep the baby away, avoid infections, and of course you'll be washing hands and feeding the baby. The baby will provide you a lot of fun, but these tips are meant for you to take good care of the baby and also to give you some danger signs where